Hi, my name is Jayla Schultz, and this is my film analysis. Today, I'll be analyzing Daisy Randone from Girl Interrupted. I'll be using concepts of emotion, motivation, and personality to create a psychological case, presentation, and explore her behaviors, diagnosis, and possible treatment. Daisy Randone is a patient in a psychiatric hospital called Claymore. She is very withdrawn, follows strict routines, and prefers to isolate herself from others. The film takes place in the 1960s, a time when mental health treatment was more institutionalized and heavily stigmatized, especially for women. It is also important to note that Daisy has a history of trauma involving an inappropriate relationship with her father. This trauma likely plays a major role in her need for control and emotional withdrawal, as trauma can impact both personality development and emotional regulation. I would diagnose Daisy with obsessive compulsive personality disorder, or OCPD. This disorder is characterized by a stronger need for control, rigid routines, perfectionism, difficulty expressing emotions. Unlike OCD, which involves intrusive thoughts and compulsions, OCPD is more about personality traits and long term patterns of behavior. Daisy's strict eating habits, routines, and emotional restriction align more closely with OCPD. Cultural context also matters here because in the 1960s, her behavior may have been misunderstood or misdiagnosed due to limited knowledge of personality disorders. In the 1960s, mental illness carried significant stigma, and women were often labeled as unstable or difficult rather than properly diagnosed. This cultural context likely influenced how Daisy was treated. Additionally, different cultures may interpret her behavior differently. In some contexts, her routines can be seen as discipline rather than a disorder. Stigma can also prevent individuals from seeking help, which may contribute to worsening symptoms and isolation. One key symptom Daisy shows is extreme need for control. She eats only specific foods like rotisserie chicken and follows very rigid routines like hiding the chicken carcasses underneath her bed. Um, this behavior suggests she is using control as a way to manage anxiety and emotional stress. Another symptom is social withdrawal. Daisy isolates herself from others and avoids forming relationships from a motivation perspective. This may be a way to avoid stress or emotional discomfort. Her trauma history also may contribute to both of these symptoms, as control and isolation can act as coping mechanisms. One important thing to note is that Daisy does not clearly display compulsions, such as repetitive checking or counting behaviors, which are typically associated with OCD. This strengthens the diagnosis of OCPD rather than OCD because her behaviors are more about personality traits and control rather than intrusive thoughts and compulsive actions. A recommended treatment for Daisy would be cognitive behavioral therapy, or CBT, which helps individuals challenge rigid thinking patterns and develop healthier behaviors. Because of her trauma, trauma informed therapy would also be important to address the underlying causes of her behavior. However, there are barriers to treatment. The institutional setting may limit her autonomy, and stigma may prevent her from fully engaging in therapy. An ethical concern is balancing effective treatment with respecting her independence and personal boundaries. So, to conclude, overall, Girl Interrupted provides a somewhat realistic but dramatized portrayal of mental health illnesses. While Daisy's symptoms reflect real psychological patterns, the film simplifies the complexity of the diagnosis and the treatment. Films like this shape how people understand mental illness, which can either increase awareness or reinforce stereotypes. If this story were set in a different cultural context, Daisy's behavior might have been interpreted differently, showing how psychological diagnoses are influenced by social and cultural factors. These are also my references for this project. One thing about Daisy is, unfortunately, towards the end of the film, she ends up taking her own life. And if the stigmatisms and proper care were given to her, that might not have been a consequence for the trauma and other issues she endured while she was at Claymore. Thank you so much.